Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. So today we are going to discuss about the conventional form of treatment or the allopathic form of treatment, what your gynaec would suggest if you are suffering from bulky uterus as well as if you are suffering from any other complications of female reproductive organs that cause bulky uterus. Because there is hormonal fluctuation prior to all of this, they would prefer oral contraceptives. So what do oral contraceptives do? Oral contraceptives will have a certain amount of synthetic hormones in them so as to balance out whatever is not there in the body, especially progesterone level. But what happens after you stop it? There is recurrence in the symptoms. Second thing, before stopping it also, if you by mistake stop the 21-day pill in between, you will experience mid-menstrual bleeding. Apart from that, if you are using contraceptives, you cannot get pregnant if you're planning for pregnancy. And apart from that, they have side effects like weight gain, hair fall, and there is oiliness of the skin, acne of the skin. And then after stopping these medications because of these side effects, you will have a recurrency of the symptomatology. And also the disease as such. Then we have GnRH agonists, which will give menopause-like symptoms. The problem with this is that because they are creating a temporary menopause-like symptoms, there is problem with the body. They will experience hot flushing, they will experience vaginal dryness, mood swings, and apart from that, as soon as you stop it, again the heavy bleeding returns back. And then we have Merino or this IUCDs, which release the progesterone inside. It is a device. If it is not done properly, it can cause perforation of the uterus. If the device has fluctuated sides or it has, misplaced itself, and then even after having the Merino or IUCDs, some people do not experience any sort of decrease in the symptomatology. So these will have their side effects of their own, right? And apart from that, they will give you NSAIDs, which are painkillers. Usually what these painkillers do is that they will suppress the pain, but they're not doing anything which is causing the pain, right? And if you're using this NSAIDs, what will happen? NSAIDs have to be taken with proton pump inhibitors so that they do not disturb the gastric lining as such. So if you're taking proton pump inhibitors for a longer period of time, or you're taking NSAIDs for a longer period of time, what will happen? The nutritional absorption will decrease, gut flora will be disturbed, and also gastric lining will be disturbed, and a longer run can lead into kidney problems as such. And then if nothing is working out, even after giving so much of medication, you have to get myomectomy done, which is removal of the fibroid along with DNC for the bulky uterus. But after fibroid removal and after DNC also, some people experience reverting back, that is another fibroid grows in the same area or sometimes in the opposite area. We have had cases who have come to us after DNC, who have come to us after myomectomy also. So there is recurrency. And then we have hysterectomy. If you are getting hysterectomy done at a very early age, it is not advisable because it will take a toll on the calcium level in your blood. It will take a toll on the thyroid level in your blood. It will take a toll on your overall health, the mood swings, the hot flushes, and all of this you have to experience at a very early age, and you will experience hypocalcemia, and your bones can become very fragile, and then even little bit of falling down can cause fractures in the bone. So we do not want this also. So we need a medication which will not give side effects, which will be effective in treating the diseases and will not give any sort of recurrences. And even if you stop for 5 or 3 days, sometimes in between, should not give you mid-menstrual bleeding. We have a system of medicine which does all of that, which is nothing but the homeopathic form of system. Why do you need homeopathic form of system? For bulky uterus. See, bulky uterus which is complicated with fibroids, or bulky uterus which is complicated with PCOS, or bulky uterus as such, or you have adenomyosis with bulky uterus, the primary problem is the emotional pattern and the physical hormonal imbalance. You need a medication which matches and understands the link between your thinking pattern, your response pattern, your stress receiving pattern, and the stress response pattern, and then how your hormones are fluctuating. And it will help in balancing out the hormonal imbalances. It will help in balancing out your menstrual irregularities, so you will be getting your menses regularly. You will be having effectively, your health is much better, your fertility rate is better, you can conceive, and your symptoms are relieved, you're cured of the current condition. And after the timely treatment of homeopathy, the recurrency compared to allopathy is very less, so you can prevent furthermore diseases. Coming to the consultation options, we have discussed how homeopathy is the best form of medication for lifestyle disorders. Here we are discussing how Fidicus Homeopathy is much better. At Fidicus Homeopathy, we have two kinds of consultation options. The one is the online consultation. The second one is the offline or in-person consultation. If you are staying nearby the nearest branch of Fidicus, you can come and contact us in person. But if you are someone who is staying far away from us, you can contact us online through audio consultation option or through the video consultation option. Once the consultation has taken place, the investigations are verified and the medicines need to be given, especially to the online clients. Medicines will be door delivered to you. If you're staying in India, 3 to 4 business days, USA 3 to 5 business days, across the globe anywhere, 4 to 8 business days, our medicines will be taking to be delivered to your doorstep. If you would like to contact us, you can contact us on this number. You can call us, WhatsApp us, or message us on this number. And if you'd like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. Here we have seen how homeopathy works best for lifestyle disorders, right? Here we are discussing why Fidicus Homeopathy is the best option in all homeopathic hospitals. Fidicus Homeopathy stands for highest chance of health. Here we are following three major principles. One being, we are experiencing high success rates in adenomyosis, endometriosis, bulky uterus, fibroids, PCOS, PCOD, dysmenorrhea, cervical erosion, and even PIDs, right? So the success rate is really high. And second is the transparent treatment. There is no gray area between the patient and the doctor. The prognosis will be clearly explained to you. And the third thing is the personal care here at Fidicus Homeopathy is top notch. Any sort of queries, myths or questions that you pose us, we will be answering it to you. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.